Good morning, everyone. We're going to start the September 14, 2021 Human Trafficking Work Group meeting. Thank you, everyone, for who's joining both virtually and in person. We have a long agenda, but a good one, so we'll just get started. My name is Milana Vayner. I am co-chair of the Human Trafficking Work Group. I co-chair the group with Ashley McCary, who is she still on here?
Yes, she's on.
Okay. Hi, Ashley. Hi. And we'll just get started. First, we'll start off for approval of minutes. We're going to send those around at a later date.
I set a deadline. I'll send everything back by the 31st of October. I'll have everything together and ready, and that way I can make sure that we're all up to date by then.
All right, sounds good. So we're going to send around internally the agenda minutes from past meetings, have the group, you can vote virtually to approve them, and if so, we'll post them to the county website. Next order of business is member updates. We would really like to hear about how COVID-19 has impacted your organizations. You know, it's been a year and a half, and things keep changing. We keep adjusting. We feel like we're back to some sort of normal, and then we kind of go backwards a little bit, then forwards and backwards. So it would be really interesting to hear how all your various organizations are responding to COVID as it evolves.
Do you want me to start?
Yes, please.
I'll start. Casa,
introduce yourself.
Yep. So I'm Jennifer Stein, the executive director for Casa, Baltimore County Court-Appointed Special Advocates. We work with children in foster care. So a couple of things for us. Our volunteers are currently able now to go back to in-person visits if they are vaccinated, which has definitely made a difference because one of the sort of cruxes of our organization is the relationship building with the kids, and it's been very difficult to do it all virtually, so we're very happy about that, but we still have a lot of limitations in terms of either volunteers who are unvaccinated are not allowed to do that yet, and some volunteers just aren't comfortable with it yet. One of our issues is that it's taken a very long time to get kids vaccinated for those that are eligible. There are a couple of different reasons for that. One is I'm hoping that will change with the full authorization of the vaccine, because with emergency use, social services had to get parental approval, and so that was taking a very long time. Now I'm hoping that they'll be able to just consent themselves so that they can get the kids vaccinated. And then the older kids have a lot of hesitancy. So we also know that a lot of our kids, particularly the ones that are at risk here, are choosing not to get vaccinated. And so that's a concern also in terms of where they're going and what they're doing. We had another comment about COVID, and okay, I'll let you know when I think of the other thing I was going to say, but that's what I was going to say, is that there has been a slight increase in reporting of cases that we know of. So there had been a 75% drop in reports of abuse and neglect across Maryland when COVID first started, because kids weren't in school, they weren't going to the doctor. That's been increasing. We have seen more reports and more kids are coming in, but I think it's not up to where it should be. So there's still a lot of, I think, community awareness to be done in terms of making sure people know what to look for abuse, neglect, and signs of trafficking. Because I think it's still a community issue as opposed to necessarily the people that are typically reporting things, which are the doctors and the teachers.
Thank you.
Sure.
Anyone else?
Right now, as far as the police department, Lieutenant Dave Barton, the vice unit, right now we're not restricted, so we're just currently going on with what we normally do as far as our proactivity.
Anyone out there in virtual land want to share?
I'll go. Mike Ford, School Safety, Baltimore County Schools. Of course, we're seeing the ramifications of students and parents being out for a year. Actually, it's been the parents' behavior more than the students that's been concerning. All of our schools are having a big issue with drop-off and pickup processes right now. It seems that most of the parents would rather drive their kids to school than put them on the bus. Part of that is because the buses really doesn't have a lot of mitigation factors in play. But what it's done is most of our schools are designed for either walkers or bus riders. So the traffic jams have been extraordinary all over the county, and we're starting to see more and more show poor behavior. And of course, then we had the ransomware, so we're still trying to recover. Every now and then we find bits and pieces of missing or critical information from that. That's it.
I'm happy to go. So at Turnaround, we are have been in office providing in-person services since March. We were providing clinical services in person actually since last June. We are requiring vaccines for our staff and volunteers who come into contact with clients. So we were trying to create the safest space possible for survivors when they come to see us, especially because we serve so many kids that cannot be vaccinated yet because the vaccine is not available. We have seen a significant increase in domestic violence cases. With trafficking cases, we had a sharp drop off, and that is slowly starting to pick back up. It's interesting, but because of the Regional Navigator program in the county, the numbers aren't as low as they otherwise would have been, because there's a population that otherwise would have not gotten services from us that is getting services from us. But there were some decisions made in the city regarding prosecution of those engaging in sex work. And so normal referral sources for us in the city, they have not been referring. And so we are adapting our outreach methods in the city, and the hope is also to utilize some of that knowledge in the county as well, so that we're just thinking of other ways to reach survivors that otherwise maybe haven't come into contact with law enforcement or with the hospital system. I'm trying to think if there's anything else major that's going on. All of the services are available, so everything that we would normally provide in a year that is not a pandemic, we are providing now. There are some, I wouldn't say restrictions, but we're asking for people to have an appointment before they come in, although the reality is we've had plenty of walk-ins, and so we're just open and available if anybody needs us.
Okay, thank you. Anyone else?
I can go. This
or
is
willing?
Krista Trahan from the CAC in Baltimore County.
Thank you.
We have been open for business throughout the pandemic at the CAC. At first allowing one family at a time to come in. We were doing teleforensic interviews for a little while, and now we're just using masks and interviewing. We'll have up to 2 families in the CAC at the same time. We did not see a decline in sex abuse numbers like physical abuse and neglect did. We did see a decline in trafficking numbers, but like Amanda said, we're starting to see a few more trickle in. I'm not sure that that's translated to prosecution for Stacey Amparo, but hopefully it will in the future. But it's been, I'm not sure what that's about. I don't know if anyone has any ideas, but we have had a drop off in our trafficking numbers. That's it.
Hi, everybody. Stacey Amparo from the State's Attorney's Office. I have approximately, I would say, 2 to 3 active trafficking cases right now. We are open for business over here in the courthouse. Everything is seemingly back to normal. We're selecting juries over at the American Legion, which is going to take place, I think, through the end of the year. But we are up and fully running to capacity, wearing masks in court, of course. You know, as far as the active prosecutions, I will say I have 2 to 3 cases, but otherwise I haven't seen anything new going on. So I don't know if they're not making it to me. I'm not sure what the deal is. But I know we are also looking at maybe some other strategies to try to locate pimps in the county. I'm not sure where we are currently with that, but it is in the works.
Stacy, can I ask you a question? This is Jennifer.
Hi.
Hi. When you say you have 2 to 3 active cases, is that a typical number for you to have going at once?
It has been low the last couple of years.
Yeah.
You know, so I can say, I mean, I have a caseload of, you know, approximately 70 to 80
Right.
sex cases. So, you know, it is pretty, I would say, on par with the last couple of years. The cases I have are a different type of case, where we've used, you know, maybe a CI to locate a pimp. So that should be interesting to see what happens with that when we argue motions, to know going forward how receptive they are to the cases. You know, that we're actually, because, you know, like you said, with the numbers being down in general, of course, I'm going to see less cases.
Right.
But right now, I would say it's on par with what I've had the last couple of years. I would say I started to see a drop off about 2 to 3 years ago. So.
Okay. Thanks.
Are victims typically cooperative in these cases?
No. A lot of it, you know, it's an uphill battle. Sometimes it's just locating victims. A lot of times, you know, there's a lot of, you know, so, since I started handling the sex offense cases as well as the trafficking cases, I'm seeing a lot of crossover. So, you know, I have one case right now where it is not charged as trafficking. However, all indications are that, you know, these girls either had been trafficked and hadn't disclosed it, or, you know, they were ripe for trafficking, essentially at high risk for trafficking. So, you know, that being said, I know in that case specifically, 2 of the girls have since been placed out of state, and getting cooperation with DSS in those other states, quite frankly, is difficult, because the girls are receiving treatment and they don't want, you know, to have to send the girls back for court. I recently have gotten a letter from one of the victim social workers, where, you know, essentially she was like, I don't feel like this girl can testify, and I don't feel like it will help her to be involved in the court process at all. So, yeah, I mean, quite frankly, there are a lot of hurdles. And it seems, you know, that getting the letters from the social workers as well as from, you know, whoever is the caretaker out of state, it does, in this case especially, make it extremely difficult. So, but we have prosecuted cases without victims before, and I would make every consideration to be able to do so in this case, because it seems like I'm probably going to have maybe one victim out of the 3, but that one victim did witness some of the sex acts with the other victims, so that would be helpful.
You asked about cooperation. Yesterday, SVU brought in to the CAC a 13-year-old that they found in a hotel, and she was extremely volatile, like tearing up the CAC, and they had to EP her. So that can be pretty typical, I think. I think we did make the turnaround referral. So Amanda, you may be getting involved with that case.
Okay, thanks for the heads up.
Sure.
Amanda,
So
I
will just say I do have to jump out of this meeting to go to court at 9 a.m., but I am going to try to rejoin when I get back. I just wanted you to know I'm not just jumping off. Thank
I
you.
have to jump off at 9 too for a meeting. Sorry.
We can send notes once we're finished.
Thank you.
Thank you.
So, and as far as the hospital, no big updates there, and I'll let Kelly kind of talk about the outreach from our end. We have not had too many identification of trafficking patients or suspected patients. We did have one recently that Kelly can talk about, and we unfortunately weren't able to connect with her before she
left against medical advice and kind of rolled out of the hospital really quickly. But I was really impressed because the emergency doctor was the one that put in the referral to SAFE, based on some of the trainings that we have given him. So that was really amazing. And I also think that when we do trainings, especially in-person trainings, we do see an increase in identification. We have the yearly competency that all the nurses take, and I think that that's coming out sometime soon. So I think that we probably will see an increase at that point once that education gets pushed out. But as far as numbers, we haven't really seen too many. Kelly's in the office more than I am, so she could probably speak a little bit more.
We haven't seen a lot. We've had the, like Ashley said, the nurses and doctors on the units are doing a good job because they are picking up on some of the signs. They're seeing some of the red flags. The one young lady in particular, she came in with a man that was much older than her, history of IV drug use. She had had a seizure due to withdrawal. And he actually made her sit in a chair and laid on the hospital bed. So they were just, they picked up on it, called us, we went up right away. And by the time we got up there, her gown was laying on the floor and we walked out and saw her getting into the car with this man and driving away. So, they're doing a good job. They're identifying. I think, like Ashley said, the trainings are really, really helpful. And Ashley and I have talked a little bit about possibly doing some updates, because what we are seeing too is that if someone in the hospital identifies or picks up on signs of trafficking and they let us know, they get a little frustrated when the person doesn't want to speak to us. If being an adult, if they don't want to speak to us, if they deny anything that's happening, they kind of think that we need to call the police right away and this all needs to be reported and the police need to come. So we're going to maybe talk about updating some of the trainings to let them know that even though they identified it, it's great. They're picking up on, on those red flags, but there are sometimes if they deny, trafficking, and if they don't want help, there's really nothing that we can do other than provide resources. And a lot of times they won't even take the resources from us.
Yep. And to add on that, there is a lot of frustration where we have heard from some of the healthcare providers that, or that just the sense that we're getting is that, they are identifying, they're reporting to us, and then nothing is happening. So even when we do have police involved in one semi recently, and there was really nothing that could be done, even though like all these red flags were going off, there was really nothing that can be done. And this child was sent home with who was identified as her legal guardians. So we don't want that to deter people from going through the process of making a report to us, just because they don't think anything's going to be done about it. I do want to kind of reiterate that education that it's not always going to end exactly how we want it to, and we can only do the best that we can, and not every case or every patient is going to get treatment and be saved. Like you want to believe that that's how a trafficking patient or a trafficking victim, kind of how they will act, is that they want to be saved. So that's something that we want to focus on. And then also just the kind of the process of what happens when that doctor or nurse or whoever in the hospital identifies a patient. I feel like if they would have identified, called us immediately before going even back into the room, Kelly or Laura could have been there ready to talk to that patient before she had a chance to leave. And I think that going in and out of the room made that person a little suspicious, and that's when they decided to leave the hospital before SAFE could get there. So I do want to talk more about processes within the hospital just to make sure that we're able to get there as soon as possible after there's a suspicion.
All right, thank you. I think we can move on to our next agenda item. Amanda, are you on the road still, or can you talk about the Maryland Human Trafficking Task Force 2021 legislative agenda and accomplishments?
I can definitely speak to it. I am still on the road, so if you lose me, I'm in like the hills of Baltimore County right now. So the 2021 session, the task force did not, we'll say, champion any bills. That was strategic because we anticipated that most legislation was going to be focused on police reform and was going to be focused on COVID specific pieces of legislation. So the task force instead stayed on top of anything that was related to trafficking in hopes that we would be able to educate and further any bills that potentially, could touch trafficking survivors. So the kind of bills that we were following most closely, one of them is related to sexting. Some of you may be familiar with this bill. I think it's been introduced twice at this point, or 3 times. And it was, for all intents and purposes, looking at sexting from the position of a child victim, and also potentially someone that could be a child perpetrator. So a child that took a picture of him or herself and then posted that picture online, and what the implications of them posting a picture of themselves, nude or body parts of themselves that could be considered as pornography, the impact on the criminal justice system, how it would affect them. There was a case, I want to say it was Caroline County or Carroll County, in which a child was prosecuted for posting a picture of herself, and it was she was engaging in a sex act in the photo, and it went all the way through the juvenile justice system. So the legislature wanted to look at this in terms of, is there something better that we can do? So the task force took a look at that because obviously there are plenty of instances when child victims potentially could be taking pictures of themselves or pictures of each other, and then posting them for, on ads or on OnlyFans. And what would the implication be then if the child was then caught up in the criminal justice system? So we, or the juvenile justice system. So we did take a stand on that bill. We, I wouldn't say lobbied for or against it, but we were involved in the conversations. Parts of that bill did pass. Required to engage in education, and very far, so we're hoping to reintroduce something similar this year. The task force also spent some time working on a bill that's, I think, 5 times at this point, related to a hotel. So if a hotelier is renting to someone that, and it really is, it's well beyond just renting to someone that is either engaging in prostitution or is engaging in trafficking. The real catalyst is all hotels should be keeping certain records so that if law enforcement needs them for prosecution or investigation, they'd be able to access them related to trafficking. And then also that all hotels would be educated in trafficking. That bill, every it's introduced, the Airbnb lobby comes in and it becomes very conflated because Airbnb is not included in this piece of legislation. It's only hotels. And to be perfectly honest, there is not, I think, strong evidence that we've, other than anecdotal evidence, that Airbnbs are being utilized for trafficking. So it ends up becoming a 1.5-hour bill hearing in which all they talk about is the difference between Airbnbs and hotels. And so that one did not pass, but we anticipate again that it will be reintroduced this year and it will be something that we look at. The task force took on a series of other bills. Most of them, it was just because it either touched trafficking or there was a potential that it could impact trafficking survivors. There was, I think, one bill that was dealing with the sex acts of I think it was law enforcement engaging in sexual contact with a victim or witness. The task force was asked for its comment on that because of some of the information that was in the consent decree. So the task force provided some input on that. But overall, the task force, we were very engaged, and there were 12 bills total that we weighed in on, but we didn't champion any bills. There weren't any bills that were like the task force's bills. But there are going to be some this year. We're actually gearing up for that now. So if anybody is interested in that or being, helping with legislation or anything that you're seeing that you think it would be really awesome to see a piece of legislation that dealt with this and would help trafficking investigations or trafficking survivors, please let me know.
And actually, since I know you might need to hop off a little earlier before 10 o'clock, that was one of the later agenda items about the Maryland Human Trafficking Task Force and the legislative agenda for 2022. Is there anything you can share at this point, or we'll save it for the next meeting?
Yeah, I can. Some of the things that we're looking at are, of course, champion the bill. Actually, that the regional navigator came out of that would look at the criminal justice system and how it interacts with the child that is trafficked overall. So, information. So, in some states it's called safe harbor. So, for the same.
You're breaking up.
Oh, I am sorry. Can you hear me now?
Yes.
I'm like the Verizon guy. So the task force is looking at safe harbor again. That likely will be the big a handful of others. There's a great bill to Senator Hedelman about potentially that is earlier on, or lots of other things we're looking at related specifically. Would be really
Amanda,
helpful to hear
we'll
from
send her
is
out.
law enforcement, because we have not heard.
Amanda, I think you're really deep in those county woods right now. Well, we can send some bullet points to the group as part of the notes later on.
Sorry about that.
Hello? Okay. Ashley, any updates, legislative or policy updates in terms from the Maryland Hospital Association, or and then I know that Jen was going to talk about a little bit of the foster youth and Voca victim services updates.
Yep. So from the Maryland Hospital Association, and Joyce might be able to also kind of jump in on this. I don't think there's anything new other than the updated guidelines from early 2020 for healthcare facilities. There are some free trainings that can be shared that are through the Maryland Hospital Association and the Safe Center for healthcare providers and healthcare facilities, just talking about SERVE model. So that's something that we can share with other healthcare facilities in Baltimore County. I'd have to really look into it, and Joyce, you might be able to speak on this, if they're appropriate for urgent care centers, or if it's mainly kind of geared towards bigger hospital facilities. I'm not sure about that. But as far as the guidelines, all of the hospitals in Baltimore County have agreed to take on those guidelines and implement them into their practice. And all of the hospitals have identified champions. And I do have that list somewhere, so we could always kind of reach out to those human trafficking champions from the other hospitals just to see, you know, what the status is, if they've implemented those guidelines, if they need any assistance. And that's, again, I know I always talk about like consistency throughout the county, but that's just to maintain that consistency. So if a trafficking patient goes into any one of these hospitals in our county, hopefully they're going to get the same response and same treatment, and you know, are going to be identified and reported to the appropriate people.
So just to reiterate some of the information Ashley just said, we are still training, and we will go out and train anybody, whether it's an urgent care center, private practice, or anything like that. We're happy to go out and provide additional trainings. And just to let you know that the next medical subcommittee meeting is going to have Jordan Greenbaum talk about ICD coding, because one of our biggest challenges is trying to collect data, and providers are reluctant to put the actual ICD-10 codes in their records, only because of the now transparency with consumers being able to access their records. So she's going to have a talk for us. It's in October, and if I look quickly, I might be able to tell you, October 14th. So that will be at 1:30, and we will be sending out a link on that.
Can I get an
Say that again?
Can I get an invite?
Sure, absolutely.
Because I know the ICD code is really, it's like a hot topic.
Right, and so we find that they are using some of the Z or T codes, but you know, in general, people are just afraid to, I don't want to say they're afraid really, but they just, they understand the implications, if somebody accesses that, and then if their trafficker would see that, then that would be, an unsafe situation for them.
So for anyone that doesn't
Can you
know,
explain what that coding is for someone that would know?
I'm sorry, there was an echo.
Can you explain what that coding is for the non-health workers?
Yeah, so ICD, oh, there's a big echo. Can we mute? The ICD coding is basically just a medical diagnosis code. So if someone sees their primary care doctor and they are diagnosed with hypertension, high blood pressure, it's just a code and the name of the medical diagnosis that is put into their medical record. So they had developed ICD codes specific to trafficking, whether it be trafficking of an adult or trafficking of a minor. And they were able to actually put these ICD codes into one of the semi-recent updates. I think it was 2018 or 2019, Joyce might know, to where they're available to healthcare providers as an actual diagnosis for trafficking. But the problem is that if you put an ICD code of trafficking in somebody's medical record and they go to another doctor who does not have any training on human trafficking and they say, what is this? Like you were a human trafficking victim. What does that mean? And they say it in front of the wrong person, or they're not trauma informed. It could cause a lot of issues. And now with the CARES Act, where everyone has access to the entirety of their medical records, if anything about human trafficking is seen in their medical record, most of the time with victims, they're not the ones that are accessing their records. It's the person controlling them. So it could cause a lot of issues there too. So I think that training will be really good. And Jordan Greenbaum is an expert from Atlanta, I believe. She's amazing. She's a pediatrician and she's championed lots and lots of anti-trafficking efforts. Actually, we saw her at Sinai back a few years ago, trafficking conference.
Right. And I will send out what the ICD-10 codes are, just so you can have that as an attachment, just so you can kind of get an understanding better of, what these codes are.
That would be great. Thank you.
Do you want me to do the Voca real quick?
Yep.
So there was, Voca's the Victims of Crime Act, and for just a very quick background, several years ago at the federal level, those funds had been cut by a third, and so local victim providers across the country were at risk of losing a large chunk of funding. In Maryland, we've been lucky because the state has been supplementing those lost funds, but the last couple of years have been particularly, the pot was dwindling, and then with COVID, the state was saying that they were out of money, and so we're potentially not going to be able to supplement those funds. There was federal legislation that was put into place, passed the House a while ago, like maybe January or February, I think, and the idea was to basically take additional funding from somewhere else and put some money back into Voca, but it was only going to, the legislation was only to bring it back up to 70% rather than the 60 that it was at. So it was something, it's not everything. It took a very, very long time for that to pass through the Senate, but it finally did. So there is now 70% funding from Voca, and we don't know yet what the state is able to do. The trend seems to be that they might be able to do level funding from last year, which was down some, but they had a whole formula worked out about how you were going to be able to get funding, and so at least people will hopefully be able to get the same as last year. That will be an ongoing concern for many years to come, I think, given that Voca has not been restored to 100% federally. It's now up to the states to really be supplementing that quite a bit. Our organization, I had an opportunity to work a little bit with Chuck Schumer's office to give some local perspective, and I think they're very interested in hearing that. So Amanda, if you want to, continue working on that with me, I can keep us in touch with their office for future bills that may be able to restore it even more. It has to do with where the funds are coming from. Some of it had to do with prosecutions that weren't actually being done. They were being sort of, I don't know exactly how it was happening, but the fees and things like that were not going into the same bucket that they were before. And so it's definitely going to be a long-term fight, but I'm hopeful, we don't know for sure, but I'm hopeful that this year at least we will be level funding from last year, which at least gives a little bit of stability. The other catch with that is that the federal fiscal year starts in like 15 days and we haven't even had an opportunity to apply yet. So they are reimbursement grants anyway, but it leaves a lot of service providers in a little bit of a limbo. We're not totally sure if we're going to have the funds.
I'm happy to work with you on that, and I want to reiterate what was just said because of how impactful it could be. This is our largest funding source is Voca, and so the reality is we don't know if in 2 weeks, like we would be taking as big of a 30% cut, which could be, 3 or 4 positions in turnaround. So we were like looking at this 2-week window that, we're all hopeful, but nobody has said anything yet. And it's just, the time is ticking away. So yeah, any assistance on Voca would be greatly appreciated.
Alrighty, next is Ashley to give a debrief of the webinar series that we did. We started planning this time last year, right? And there were 4 sessions, and they kicked off with Human Trafficking Awareness Month last January. No, this January.
Yeah,
wow.
2021. Sorry, everything's like going together. So I'll be really quick. So we did the 4 webinars. They were very successful. I'm so happy with how everything went, and thank you to the whole group for everything that you did to kind of get this going, and to all the people that presented. All in all, so I actually canceled the Zoom subscription, so I can't go back and look and see how many actual registrations and attendees we had. But I know that all together over the course of the 4 sessions, we had a little under 1,000 registrations, but that's collectively all together. And a lot of those people were repeat attendees. For the first webinar, we had almost 150 attendees, and that was the highest attended webinar of the series. We got a lot of good feedback. So I'll just read a couple of the comments. Let's see. I have, everyone was clear, professional, and informative, very professional and polished program. Excellent program. So glad it's recorded so others can view later. This was very good in developing an understanding of how children fall victim and what has been done to minimize the trauma. Well done. All the presenters seemed extremely knowledgeable, very prepared, very good series on trafficking. I learned a great deal of information on this critical subject matter. So if anybody from the group who viewed the webinars or who presented in the webinars, if you do have any feedback about what you liked, what you didn't like, kind of how we could improve that in the future if we ever take on something like this again. I think we should, and we definitely could. All of the webinars are archived on our website. So if you know of anybody who would be interested in any of these presentations, you can send them to our website. And then, so that's pretty much it on the webinars. But to kind of mention, and I know we don't really have to talk about it right now, but it is mid-September. January is Human Trafficking Month again. So I kind of wanted to start brainstorming some ideas of something we could do as a group for Human Trafficking Awareness Month, whether it be something virtual again or something in person, or maybe even just doing like kind of a small little infomercial, just something that we could do to kind of get some more awareness out to the county. But we can brainstorm at another time. I can send some emails, but if anybody has any suggestions or any ideas, please let us know.
Thank you. Amanda, I don't know if you have anyone else on the line from Turnaround to give an update on the Regional Navigator Program as the Baltimore County Coordinator for the state.
All right, so somebody jump in if they can't hear me. I'm like almost to my destination here, but so we have served since October 43 kids. We've had 43 referrals. The vast majority of those have been from the Children's Home and Arrow, but also definitely a lot of cases coming in through the CAC and DSS. We are not seeing a ton from law enforcement, and so that is something that we're watching. And then we also noticed that we were seeing a drop off in terms of DJS numbers, so we've been in contact with them. In terms of the types of things that we're doing to bolster referrals, we have done training for the school system, so for the SROs and for the school therapists, school counselors. We have made a connection with Prologue, where they've actually sent over several referrals. And we're looking at DJS for some increase in re-engagement and training. So we've been in recent conversations with them. As I said, we are still trying to figure out for law enforcement in general, like if there is a way for us to do like a full law enforcement wide training, because I think it's important that everybody understands what the law is. We did put out a bulletin to everyone in law enforcement, but we are seeing across the state that there are, which is the reason the law was written the way that it is. We wanted to be able to count, like for CPS, if CPS is getting so many referrals, you know, is law enforcement seeing those same cases and vice versa? And across the state, we're seeing discrepancies in terms of how many are going to CPS versus the regional navigator, and then how many are being referred to law enforcement. And I think that now looking at our numbers, it's been interesting because I'm not sure with law enforcement in particular if the discrepancy is that they're not getting referred the cases or the cases are just not getting to us. So I think there's just some conversations there that need to happen, which I'm excited about. Oh dear. That is my update. The end.
We got 95% of it.
All right, good.
All right, so next on the agenda is County Council Resolution 2321. It was a request for the Human Trafficking Work Group to review county laws, regulations, policies, and make recommendations on possible legislative action that would be within the local purview of the County Council. We have in attendance the Council Secretary and Assistant Secretary, Adam and Tom Boswick. We also have 2 members of the Police Department. Floor is yours.
Well, we were approached by Councilman Quirk initially back in late December because he had been contacted by Lieutenant Barton, and Lieutenant Barton, and maybe you want to kind of tee it up.
So I had a meeting with Councilman Quirk and just asked like some issues with the county with crime. I said one is basically it's human trafficking, labor trafficking of massage parlors, mostly the Asian massage parlors. And throughout the years, what we've seen is we'll go in, we'll get a complaint, we'll do an operation on a massage parlor, and we'll go send a detective in, and they'll have unlicensed workers in there who are not licensed masseuses through the state of Maryland. The only thing we can do is lock up that individual who is really a victim of labor trafficking or human trafficking. You know, these girls come down through New Jersey, they're brought down here to work. They will almost always never admit to being a victim of human trafficking. So the only thing we can do is arrest them on them giving a massage without a license. The business, the manager, nothing happens to the manager. The business continues to operate. We can't shut it down because there's no laws saying that they violated, they have workers who are unlicensed. Nothing happens to the business, so they continue to operate. We just had one recently on Bel Air Road. Actually, they did shut down and move out, but we've been watching it for over a year and a half due to COVID. We knew the girls were coming down from New Jersey. once we went in, they were doing sex acts. Not one of the workers said that they were victims of human trafficking. We knew the girl who was running it was going up through New Jersey. They were sending these girls down sometimes on the bus, and then she was going downtown Baltimore and picking them up. She'd also opened up a business on down in Salisbury, so she had two businesses going. And in the end, still open investigation because we don't have, I mean, no one said they were a victim. We're still waiting on forensics for the case. Luckily, this business did shut down. This girl packed up and has since maybe moved to Delaware or somewhere, we think. But we know there's some businesses we've hit over the years. They're still operating. And we don't go in and target them just because they're Asian massage parlor. We usually wait until we get a complaint, and then we start our investigation. But I know there's probably at least 2 or 3 right now who we hit before with unlicensed workers who are still currently operating because we can't shut the business down. So what I was just looking to do, Montgomery County had proposed bill years ago where they could go in, if they had 2 or 3 violations, the county could go in and shut that business down for 30 days and say you can't operate and charge them a fine.
And that was more of like a business regulation statute.
Correct.
I think.
So that's kind of what I was just trying to get, another tool to help assist us with shut these. And it also takes away from legitimate massage businesses. You know, I mean, they're undercutting, they're charging $50 where a legitimate business charges $80 or $90 an hour, but they're using unlicensed workers and to do it. And it's, even if they're not doing sex acts, it's still labor trafficking and bringing them down cheap from New Jersey, and they rotate them out every so many months. Just looking at another tool to help us with it.
I believe Amanda was involved in the Montgomery County legislation. Is that right?
I was, yes.
Great. So when Councilman Quirk approached Adam and I about drafting a bill potentially to help Lieutenant Barton and the rest of his department, we looked into the Montgomery County legislation. I think there was a couple of more, right, Adam? Howard County as well. And so we started putting something together. In fact, I think we had a draft or at least a couple of drafts. And I think, why don't you take over now, Adam?
Well, actually, Amanda, I drew on your expertise. So, and you were involved in the Montgomery and I think the Howard County bills as well. So maybe if you could give us kind of a, how did those end up, how effective were they?
Right, because before you start, we ended up kind of backing off from, we were all sort of not ready to go, but we were in still the research drafting phase. And I know Adam had conversation with you and looking at it, we were of the mind that we might be doing more harm than good because of the effect that this type of law might have on the victims and not so much the perpetrator. So anyway, why don't maybe you can take it away.
All right, I have made it to my destination. Hopefully there is enough signal up here. So yeah, I think that you're absolutely hitting the nail on the head. And there's actually been a series of things that have come out through Polaris where they've spoken about these pieces of legislation and the impact on the businesses themselves and then the impact on the survivors that we're trying to reach. And unfortunately, what they're finding is that they're not seeing the businesses shut down, and instead they are seeing that the people that are being kind of scooped up in and caught up in the new legislation are the victims. And they're then being fined, or they're being, being again caught up in the criminal justice system. And so they have not, and I'll say they being broad national, like Polaris, has not found that anything is quantifiably effective yet. When we had discussions in Montgomery County, they were as broad as, can we just attack the business? Can we attack the landlord? Can we attach things to the structure itself? Are there things that would never even touch the victim inside the building. And as soon as we started going down that path, there was hesitancy because of the impact potentially on business. And so I think that there is an answer here. I wish that I had what it was, but I think with everybody, you guys are absolutely right. Like the real question is, how do you write something that is not going to just criminalize the victim, or is not going to create a harder time for the victim to get out, and is actually going to go after the person or the group that you intend to go after. And so I'm happy to share the Polaris study that they did, where they looked at the different things. They made some recommendations, and it was very heavy-handed against the business itself. And it's just a question of, is that something that the county is willing to do? I know that in Montgomery County, again, we had those discussions, and we went down a path, and then there was some pullback. But I certainly think that it is worth looking at in Baltimore County. What are some things that what's the path that we're willing to take?
Because I don't think the county, I can't speak for the county council, but I don't think that they would be adverse to making life a little more difficult for the businesses, even maybe the legitimate ones, because I almost think about it as we're talking about this. I think about the SAFE Act, gun safety legislation from last year, which made gun. And it made gun shops have to do more to secure firearms and to have safety measures and security plans and the whole 9 yards. And of course, the legitimate ones, the ones that were already doing a lot of this or were quote unquote good gun shops, were moaning about it legitimately, understandably, saying, look, we're already doing things. Why are you placing all of these things on us? And the response was, well, because we have to legislate for the guys that don't do it right. And so unfortunately you're caught up in this a little bit, but we have to legislate to the bottom of the barrel. And I would think this might be something similar in that the county council might have to go after, like to Lieutenant Barton's point when he was describing his frustration, we might have to go after the businesses in a more heavy-handed way, not to get the legitimate ones, but to try to get the ones that aren't legitimate, and it might make the life of the legitimate ones a little more difficult. I don't know. That's just my thinking out loud about this.
Yeah, the other thing that
sorry, go ahead. Sorry, Amanda. When you say going after the business, is it like you said that shutting down for 30 days or fining them or things like that you're trying to kind of deter them from operating? Is that what you mean?
That's what we're trying to get. We're not trying to go after the victims. We just want to be able to shut the business down, take away their profit, so they won't reopen.
Okay.
Or they'll move on.
Maybe go on to another county or somewhere else.
If they're using unlicensed workers.
Correct.
Okay.
We're trying
to
avoid.
Do we know other jurisdictions or any other states that have similar legislation trying to combat this that has been effective or successful?
So the Polaris did a whole national study, and there was when they looked at states that did these heavy-handed things, and they weren't. Sorry, my connection's bad again.
I was going to say, you can turn on video if that'll be better. If that'll be a better voice connection.
It says 5G now, so hopefully that means it's working. So they didn't find that there was anything that was prescriptively effective. There was a statewide attempt. There've been multiple times a statewide attempt to put additional licensing restrictions on the masseur businesses and massage businesses, or the individual massage masseuses. I think that's the right word. And that was met with extreme. I mean, I sat through some of those hearings, just extreme vitriol from legitimate masseurs who are like, I am a standalone. I just go into people's homes and give them massages, and now you're going to put additional requirements on me. You're going to tax me more, or you're going to require that I, get additional permitting, and I now can't afford to run this side business when I'm not engaging in any of these illicit activities. So it wasn't even like the big businesses. If you're looking at like individual licenses, the other thing that we found is that when you were looking, so what Montgomery County attempted to do was like, okay, like forget the massage business completely and just go after like the landlord, or go after maybe these corporations that are investing in, people that actually have money that could actually put a stop to the business opening in some of these locations, because we know often they're opening in places like strip malls. I know in the county they typically open in like zoned commercial but used to be residential, so it looks a little bit different. And so I think what we were finding there, again, that was when there was just this pullback where it's like, are we really going to stand up against these people that are potentially, investing money, a lot of money in these counties? And so I think that it's just a question. It's a question of what you can stomach. And I think when we start talking about putting restrictions on those that are actually performing this service. So if you're requiring like a license for an individual who is giving a massage, and then saying, okay, business, you have to have the individuals within the massage business, all of them be licensed, or you're not going to be able to open. I mean, to be quite honest, I think a lot of these businesses are just going to go get their people licensed, or they're going to have, they're going to do something. And then the question turns on, do we have enough funds then to actually go in and do the regulation of whatever the legislation is, because that's how it's going to be effective. So I think there's a lot, there's just a lot to unpack. And I know it's frustrating because I remember these cases so well. But I do think that we can get there. I think it's just a question of maybe taking all of this information that has been done nationally, because so many people are trying to tackle this, and figuring out what can work best in the county, and what we're willing to, what hill we're willing to stand on, for lack of a better term.
Well, and the other issue I think is, and I'm not the expert, which is why we're here, but I would think that it's not going to get to the root of the human trafficking problem. It's just going to, it might shut down a business or a few, and make them maybe move on to another county that's, that doesn't have as good a enforcement, but it isn't probably going to change the underlying problem, which, that's the whole crux of this. So,
and I think a lot of the businesses also like rename themselves, or created a new LLC, or what else did they do, Amanda? They somehow carved themselves out of whatever definition that a massage parlor or a masseuse or whatever, a body works, whatever it is,
Yep.
and they just ever so slightly carve themselves out of it. And so unless you keep trying to change the legislation in a way that it encompasses however else they may evolve.
They do that. They change it to reflexology. Once we send a detective in and they put the hands and start massaging, massage is a massage, so we can still charge them, shut them down. They can change their name or do whatever, but once we send the undercover detective in, he gets a massage is a massage. So
I do share the concern though about sort of just pushing it somewhere else, or, that sort of like with Backpage, the sort of debate about, if you shut this opportunity down, are they just going to go somewhere else? And we know that that's not going to go away. And so I don't know what the answer is, because I think you have to do something, and there should be deterrence, and there should be, things that are going to help the legitimate businesses when this is impacting them and all of that sort of thing. But I do also think there has to be consideration for the fact that if they leave that spot, they're going somewhere else, and then we've lost them potentially, or, it's just tricky. It's very complicated. And again, I don't really know what the answer is.
well, this was originally Councilman Quirk from Catonsville's resolution, but the entire council ended up signing on to it because they all felt that obviously it's an important issue, and they wanted some guidance if there was any that could be had because obviously the council's not an expert, and Adam and I are not experts, although he's become more versed in it because he did the research. But you know, we're kind of in the same boat.
What about instead of trying to go after the businesses so hard, since there's so many kind of factors there that could affect, I guess, getting to the end result that everybody wants? Is there any way to go after the buyers in a more aggressive way? Maybe some legislation related to the buyers? Because if there's no buyers, the customers, like the customers, engage,
There's going to be a demand, and they're always
sex
not going to
act.
shut down the business. I mean, they can be given legitimate massages and not doing the sex, but they're still on-license, and they're still undercutting the legitimate masseuses who have gotten their license and went to the schooling and running a legitimate business.
Okay, I see. Oh, so the labor trafficking and it's okay, gotcha.
Yeah, so I think that's part of the issue because it's a two-pronged trafficking issue. Yeah. So
well, and we don't have to solve it today, but
so I think next steps for this matter for today would be Amanda can forward over to the group, the attendees today, the Polaris research document or report for everyone to review. We could create a subcommittee to continue work on this and then report it back to the main group for any draft. So if there is that way you can continue to work with that subcommittee we can look at the draft, and Amanda, myself, and anyone else that's interested can provide feedback and continue to move that piece forward, and get input from the various stakeholders in the county. Does that sound like a plan?
That's what I was going to say too.
Do we need a motion for this?
I don't know.
Motion for subcommittee to work on resolution 2321, local legislation related to massage parlors.
I move.
Move. Can I get a second?
I second.
All right, motion passes.
Who was that? Sorry.
I think that was Amanda.
Amanda.
Yes.
All right, moving on to the next item. We've also had a request from the administration to look into hourly hotel rental limitations, prohibitions for local hotels, and provide recommendations. I believe Lieutenant Barton was also involved in some of the preliminary research on that.
The only thing I did with this, they don't advertise for one, so they don't advertise hourly rates. None of the hotels, probably about 4 that I know in the county that do it. But when you call them, they have a 2-hour minimum. So they're not doing it by an hourly rate. They have a 2-hour minimum. So if you pass a law says it's an hourly, you can't have an hourly rate. Well, they don't have an hourly rate. It's a 2-hour minimum, or they change it to a 3-hour. So it just depends on whoever's writing the law. I guess if you have to be for 24 hours when they run it, I mean, that's just how they do it. I was just asked. There was only 4 hotels. There was like 3 on Route 40, Pulaski Highway, and the most notorious one is Tim's Motel on the west side of the county, who rents rooms by the hours. But we just as much will still get prostitution. Most of the girls who are prostituting rent the rooms for 24 hours. Really don't see it. Usually if they pick up a streetwalker or whatever they're doing, they'll come and rent it for 2 hours. Or you have drug dealers who will rent the rooms for a couple of hours to take their product inside, cut it up, and then leave and go back out to distribution. It's just a safe place for them to conduct their business where they're not being watched constantly at the same location.
So you're saying the hourly rates then are primarily not used by this population, you think? You think it's more...
It's usually if they're prostituting, they're going to rent the room as 24 hours because they're setting up shop for long term, not just it's not profitable for them to move on because they're putting the ad up, they're calling people and they're bringing them to that location. So they're not going to be switching around.
Mm-hmm.
It's more for the drug users or they're bringing a streetwalker from somewhere, then they would be doing that the rate.
Right.
But except when they looking into writing that law, I mean, I don't know how, like I said, they could change it to 3 hours, 4 hours, just how they skirt around it.
Okay.
Okay. So Joel Beller is on from the Office of Government Affairs to give a little bit of additional background as to what the administration is looking for in terms of recommendations.
Yes. Hi, everybody. Again, Joel Beller with Deputy Director of Government Affairs for the County Executive. And this came about because, generally we sort of scan around when we're looking at various issues and see best practices in other jurisdictions. And the County Executive had located, I actually can't remember where the initial legislation was from, but it turns out that Prince George's County actually has something very similar on the books about banning hourly hotel rates and pushing it out to, if you rent a room, it has to be either up to 8 hours or 10 hours or something in that that neighborhood, and that the room can't be used twice in that period. Nashville, I think, was the actually the original legislation we were looking at. And so I think actually some of the members of this work group, as well as some of our internal county folks within the health department, helped us to sort of look at this. The police department gave us some background on those hotels that were just mentioned, or motels, and sort of had a mixed feedback to this. I think there's not a lot of data either way out there to suggest the places that have done this have really seen a significant drop in the use of these motels. I think that there are some issues of harm reduction, of distinguishing sex work from sex trafficking, of and of the idea of pushing this behavior out elsewhere if this policy were successful at limiting its use in the motels, which again we don't really know they would do. So we sort of ended up in this this middling position of we don't really have a lot of evidence that this would be helpful. We have some concerns of what would happen even if it were effective, and so we're sort of coming to the work group with this at least partially analyzed and some skepticism of it as a policy, and I think more to look at an alternative way to address some of the issues at these motels, or if there's sort of something we've overlooked and maybe this is more helpful than we thought, or if the policy would be tweaked a certain way. So I think we can provide this group with some of the examples that we were looking at, but we're sort of looking for your help in next steps of, okay, if this is not the solution, we still have these motels, being used for this behavior, being involved in trafficking, and is there a way similar to the discussion with the massage parlors to sort of address this legislatively or through policy change?
Okay, someone's raised their hand.
Yeah, I was involved in the Prince George's County legislation too. So I appreciate so much the thoughtfulness that's going into the conversation, Joel, and from the County Executive's office. I agree completely with kind of where the position is. I remember from the conversations in Prince George's County, one of the things that they found in coming back to the bill subsequently was that because there was really no teeth to any parts of the bill, they were having a hard time actually enforcing it. And it had two other things that are included in the Eversol bill, which is a statewide bill that may be of note, or something that may be more impactful in terms of, like, if we're talking about addressing trafficking. So the two things that Eversol has in his bill, which also doesn't have teeth, so again, that's another conversation, is training for all hotels on trafficking. And so Prince George's County married that and did the same thing, took it on. And they actually, I think Baltimore City did as well, actually. And then the other is related to kind of this record keeping that's required to ensure that if law enforcement was doing an investigation, that they could then get whatever records they needed related to trafficking. So I don't know, I think that's absolutely like a police question as to whether or not they're getting what they need out of the hotels when they're investigating a trafficking case. But I think whether it's training or some kind of cooperation from the hotel company, the Hotel Association is on board with the Eversol legislation. So I think they would even be on board with a county piece of legislation. But I think in terms of hourly rate, without knowing, number one, that it's connected to trafficking really at all outside of just the intersection with sex work, and then also like if it would be impactful in stopping any of these kind of societal issues. I think that there's other things that we could do specific to trafficking that would be more impactful, especially from what we're seeing in other counties. Like it would be interesting to know if Prince George's County saw a decrease in any type of, drug dealing or, vice level crime after implementing the law.
And I'll just throw out there also, I had a preliminary conversation with housing about this, just to see if there might be any unintended consequences in terms of their ability to use various places for temporary shelters or things like that. So I don't have a good answer from them yet, but we've started the conversation a little bit. They're gonna kind of think about it, and they've passed me to another person so that they can give their input, but I want to make sure that that's a consideration also, just because from a harm reduction perspective, I think that's an important.
What do you mean by housing?
So like homelessness, so homeless services, and whether something like this, regardless of, kind of sort of almost like you were saying, if there's a way for them to change their rules so that it doesn't apply to them or something like that. But we want to make sure that if they're using these establishments for temporary assistance, temporary housing for people, that this doesn't, if we were to have some sort of ban on whatever the time frame might be or whatever the allowances would be in a certain hotel, that it doesn't have an unintended impact on their ability to provide temporary housing for someone.
Any other questions, comments, input?
I'll just say, that we can sort of take a first step here and just for ourselves reviewing what's in the Eversol legislation and maybe seeing if we can figure out if he has plans to reintroduce that again, if there are ways we can make it better. So we can sort of pursue that angle, and are happy to participate in any other sort of research help that this group might need if there's a way for us to work collaboratively there.
Okay, so I guess my question is, would it make sense to also do a split off committee for this, or wait to see how things go and then do it as it progresses?
Was that to the group?
Yes.
Oh, okay. Sorry, I thought that was to
Including Joel, but yes.
I mean, my inclination would be that we should start one, just because I think things get delayed and take a long time, and so at least there would be some momentum to make sure that we get the question answered as best we can for them.
Okay.
But that's just me.
Motion for a subcommittee for the hourly hotel rate rentals.
Sure, I'll move. But it's not supposed to just be me.
Can I get a second?
I'll second. Amanda.
All right, a subcommittee on that issue has also been created, and we will will work internally to move that forward. So Joel, why don't you take a look at what at that legislation, and then kind of let us know how you want us to proceed further, and if anything, we'll set up another we'll set up a future meeting to discuss.
Sure, that sounds great.
Thank you. All right. Next we briefly discussed the legislative agenda for the Maryland Human Trafficking Task Force for 2022. Amanda, when you have a minute, if you can just send to me and Ashley directly some bullet points, high-level items that you'll be, like you mentioned, safe harbor. Looks like the innkeeper legislation is another example, just so we can all kind of keep an eye on it. Our next is outreach efforts and data collection to focus on a public awareness campaign. You know, we've generally tried to think of ways to make so for example, our public awareness campaign for 2021 was the webinar series. And people seem to really enjoy that. And now it's available on the county website. So we're open to any other new ideas as to how to let Baltimore County residents know about human trafficking, and labor trafficking, sex and labor trafficking, which is all under the human trafficking umbrella, and anything anyone thinks would be useful to educate our communities.
So my struggle with this is the same as my struggle with my organization, which is that it would be lovely to have money to make ads and posts and, you know, lovely things, and that's going to be a limitation, I think. I mean,
has joined the meeting.
the webinar actually put up some funds, and then we all kind of donated our time. I don't, at this moment, have someone that I could call on to do media type stuff at this point. Maybe I'll have some, but I don't know that is available for something like this in terms of, you know, creating things. I don't know what your options are there.
I agree. I think funding is our biggest issue with anything that we want to do, because my ideas are like, I want to do a huge billboard on 83 that everyone can see, to like drive people to look at our website to find out what human trafficking is. And but obviously we don't have the funding for that. We did talk about, we are going to get a little bit of funding, just like a very small amount of funding from the Commission for Women for, I think, 2022. So we were thinking about just small stuff like, okay, let's get one of those table skirts so we can do some different events, and maybe have some kind of literature or something to share at these events focused on community awareness. So those were some like kind of smaller ideas. I would love to do like a little infomercial or some kind of video that we could put on our website and share on social media. But again, that's going to cost lots of money. We don't have that funding. And like Milana and Jen and Carmen have talked about in the past, that we are a group that can't apply for any kind of grant. And I don't know if we could accept donations. Is that something we could do, Milana?
It gets a little complicated. So it would probably be better if one of the member groups of this work group were to take on donations for the purposes of then implementing it on, like, with the assistance of this group.
Right. And
Does that make sense?
It does, and I was considering we could be that group. The problem, we have two problems with that right now. One is that Voca funding is low, and so that would have been one of the main places we could have gone. The other is that all of my funding is low, and so in reality, my focus has to be making sure I can pay my employees right now. So whereas 2 years ago, I might have said, sure, I'll put a bucket aside. I don't have that right now. I know, I don't have that right now.
Do we know how other counties are doing it? Because I don't know if anyone from this group kind of travels up to Cecil County, but I do for my other job. And they do have a big billboard. I think it's off Route 40. It's not my favorite billboard because it shows like a barcode and people chained up. But it does have, it's like an anti-trafficking billboard with information, I think, about the Cecil County human trafficking task force, I think. So does anybody know like how other counties or other groups are getting their funding for things like that?
I mean, the thing with something like that is we're not a task force. We're not we're not established in the same way as other groups, right? Like so, and frankly, I would be cautious about putting something like that up where you reference the Baltimore County Human Trafficking Work Group, because we don't have a staff. We can't take and we shouldn't be encouraging people. We should be more of that public awareness outreach arm, and not the people think that they can call us to refer things for help. Yes, I'm very. That makes me very nervous.
Yeah, but we do have that. Even if it's not like, okay, we're not service providers. The group does not take on that role, but we do offer awareness and we offer resources. And on our website, we have education, we have a link to all the different resources in the county and to the national resources. So even if it's just a starting off point of what is this and where can I get help, with kind of making that clear that we don't actually offer the help with this group, but we can refer to agencies that can.
I think a part of it might be just, more of a, do free trainings to local businesses, maybe. And I think we've talked about this before, where we reach out to the local chambers of commerce, the Baltimore County Chamber of Commerce, and the Towson, the Pikes Bowling Mills, whatever, and we offer training to their staff as outreach, and we can email them a PDF, an informational flyer that they can then print out and post within the restaurant, and things like that, where it's our time and coordination, but not necessarily, money that we don't have.
Well, and I could see us doing, so maybe what we focus on in terms of that for this year, we could do two pieces. One is to figure out, talk to some of the other places that do have broader advertising and see how they have come up with the funding creatively for that. But at the same time, focusing on, appearing at fairs and festivals where we can be seen and we have our tablecloth and our handouts and things like that. I like the idea of the trainings. You could do not only chambers of commerce where you get a big group of people, but we could also make ourselves available for county council meetings and other places where leaders are gathering, so that we can, go to some of the and do even a little more of an in-depth Q&A type of, where they can ask about things that they know are going on in their areas and things like that. Again, the dedication or the donation of our time is easier, and I think that would be a way to get in front of more people that can then disseminate things. But at the same time, I also think it's worth exploring how other places are making it happen.
Yeah, I agree.
Does anyone have the time?
There's some members of this group that would be willing and completely able to donate some time and do some different presentations throughout the county. So maybe we can work on kind of a running draft of what we would want to focus on, and then see who would be available. And maybe that could be a goal for next year as well. Just trying to get out into the community and do more face-to-face trainings.
Amanda, this is when we can start training together. She's still there. She's gone.
Did Amanda have to hop?
No.
Okay. The last discussion item is the selection of new chair or chairs. We were anticipating a vote for the December 14th meeting. Just wanted to, if anyone's interested in chairing or co-chairing the work group, please let Ashley and I know that you want to put your name in the hat. You don't have to do that now.
Yeah, just send us an email at any time. And then Milana, you said we were going to discuss that at the December meeting.
Yeah, we'll discuss and then vote.
Are we gonna actually present like a slate at the December meeting, or are we?
If there's a slate to be presented, if there's if there's multiple people that are interested, I am.
But the idea is to actually vote and decide in
Yes.
December. Okay.
Yes. And then the last piece is we've just listed out on the agenda some upcoming trainings and conferences that we've seen. Obviously, we wouldn't be funding these, but just as an FYI for anyone that would like to get more training, these are some pretty good trainings that we've heard about, and some of them are more local than others, like the Just Conference in DC.
Is anyone going to any of these upcoming trainings through your organizations? Because the reason I ask is that if anyone does go to the Just Conference or any other conference that's offered, in the near future, just take some notes for everyone, and just so we can all share any kind of new practices or anything that's shared at these conferences would be appreciated to be shared with the group as well.
Agree. If there's any materials that you can share, it would be much appreciated. So we can all get a benefit from it too. Okay, it is actually 6 minutes past 10. We're 6 minutes over. I believe unless there's any other business, we can adjourn.
Hi, thank you, everyone.
Thank you.
Thank you.
Good day. Bye.